Coloncancer is a type of cancer that affects the large intestine, colon, or the rectum. It typically begins as a small growth called a polyp, which can gradually develop into cancer over time. Millions of people worldwide face this health threat each year, making it a pressing issue that demands our attention. Age, family history, and genetic conditions can increase the risk, so it's essential to know if we're more prone. But what happens if we choose to ignore the early signs of colon cancer? Ignoring this can lead to devastating consequences like advanced stages, metastasis, and decreased chances of survival. Late-stage detection means aggressive treatments with debilitating side effects and higher mortality rates. But fear not. By staying proactive and recognizing the red flags, we can change the course of our health journey and increase our chances of successful treatment. Early signs of colon cancer you shouldn't ignore. Persistent changes in bowel habits. Persistent changes in bowel habits refer to noticeable and lasting alterations in how your bowel movements occur. This can include experiencing ongoing and unusual patterns such as persistent diarrhea, frequent loose or watery stools, constipation, difficulty passing stools, or a feeling of incomplete bowel emptying, a sense that you haven't fully emptied your bowels after a bowel movement. These changes might indicate an underlying health issue, such as colon cancer, and it's important to be aware of and monitor them closely. Rectal bleeding or blood in the stool. Rectal bleeding or blood in the stool should never be dismissed or taken lightly. If you notice any unexplained bleeding coming from the rectum or if you observe blood in your stool, it is crucial to seek medical attention promptly. While there could be various causes for rectal bleeding, including hemorrhoids or anal fissures, it is essential to rule out potentially serious conditions like colon cancer, which can also present with rectal bleeding. Abdominal discomfort or pain. Abdominal discomfort or pain that persists over time should not be ignored, particularly if it is accompanied by other symptoms such as cramps, bloating, or excessive gas. Persistent abdominal discomfort can take the form of recurring pain or a constant dull ache in the abdominal region. Unexplained weight loss. This refers to unintentional weight reduction without any deliberate changes to your diet or exercise routine. If you find yourself losing weight without a clear reason, such as a change in eating habits or increased physical activity, it could be a potential warning sign of an underlying health issue, including colon cancer. Fatigue and weakness. Fatigue and weakness that persists despite getting enough rest and sleep may be indicative of various health conditions, including colon cancer. Ongoing feelings of tiredness, lack of energy, and weakness can be symptoms that warrant medical attention. Family history and genetic conditions. Having a family history of colon cancer or certain genetic conditions can raise the likelihood of developing the disease. Informing your healthcare provider about these factors is crucial as they might advise earlier or more frequent screenings to detect colon cancer early on. Take immediate action if you experience these symptoms. Prioritize your health and seek medical attention without delay to safeguard your well-being, maximize treatment options, and avoid future regrets or complications.
Yeah.